Hi, I'm Dr. Kirsten Lloyd. We're continuing on with Module 3, covering prescription therapies to treat obstructive sleep apnea. And the topic of this video is the eXcite OSA device. Now, the eXcite OSA is a very unique therapy. It actually will eliminate the need for you to wear something at night to treat your obstructive sleep apnea. eXcite OSA is a daytime therapy for those who suffer from mild obstructive sleep apnea or simply snoring without sleep apnea. It uses a principle called neuromuscular electrical stimulation, which is a tongue training type of therapy similar to myofunctional therapy, providing that therapy using electrical stimulation in a passive way so that you can go about doing your other activities while the therapy is taking place. eXcite OSA is a device that's placed inside the mouth on a regimen that is split into two phases. Phase number 1 is 20 minutes of using the device every day for 6 weeks. We call this the active phase, followed by the maintenance phase, which is continuing to use the device 20 minutes 2 times a week. It trains your tongue muscle to improve the position of the tongue. At nighttime, prevents the airway collapse that is the root cause of obstructive sleep apnea and improves snoring, improves sleep apnea, and overall gives you a better sleep quality. The clinical studies that looked at eXcite OSA showed that 90% of study participants experienced a reduction in their snoring. 85% of participants experienced a reduction in sleep apnea arousal events. If you're interested in learning more about the eXcite OSA and whether it's the right therapy for you, talk with your Empower Sleep specialist. Thanks for joining me today.